So in trials, we see both. Like, saw trials like the Nanomap that use as exploratory outcome, which means that they were trying to see if the levels would reduce with the treatment. One of the advantages is you can like have more blood collections points than PET. PET you're gonna do like once, 2 times in a year. It's more complicated. You have to go like to very specialized center, while blood you can just collect. So I think one of the objects that they are trying to do using this exploratory outcome is like being able to track like monthly or even weekly the levels of the biomarkers and see if the drug is working. They are also trying to do like as a pre-screening. So it's when you get a lot of people, you try to see if who is probably have the disease, probably not have. So you don't need to do unnecessary tests like PET if someone that probably don't have dementia. So it's the 2 use that we see now on the clinical trials, and we are seeing more here in the ADPD. We're gonna see in a another conference. It's a lot of studies focusing on the communities to try to establish how can blood biomarkers help the diagnosis of dementia to speed, because you know that the wait on memory clinics or specialized centers like go to a neurologist that specialize in this takes a lot of time, sometimes a year. So a lot of studies are testing the prognostic value of the plasma biomarker. And in the context of the communities, how it's going to work on the clinical practice, we still have a lot of studies going on, because we need to know how the blood biomarkers are going to help on the diagnosis. We don't have thresholds to see probably have the disease, probably not. It's a problem because you have different methods to measure the blood biomarkers. So that's why there are a lot of studies to see how this is going to be standardized. And also we need to train. This is going to have like we will need a training for the physicians that will request the test. So I think it's more close to be used a lot on clinical trials, because usually you have specialized people working on this. In clinical practice, I think we still have like a way, a path to go explore. But in the next years, I think we are going to be able at least to see if someone has probably or not have the disease, to go then to confirmatory tests, to specialists, to have the final diagnosis.